Have you seen a three-dimensional x-ray? I'm Dr. Scheurer from Tranquil Dental, and a three-dimensional x-ray is called a CBCT, or a cone beam computed tomography. It's a mouthful, but it affords us the opportunity to be able to see things in 3 dimensions. So if you think of traditionally a CAT scan being taken on your body and being able to actually look at slices of it, it allows you to see the 3 different dimensions. So here's an x-ray. It's a 2-dimensional x-ray that was taken on a patient. And you can actually see right here, there's a little dark circle there in between the roots. When you see it, it's a little hard to tell its exact size or its exact location. So you think that it's in between the roots, which it is, but you can't tell exactly how far it goes. So we can see how high it is, and we can see how wide it is, but you can't see how deep, or in this example, how far into the computer screen it goes. I had the opportunity to have this area, we had a CBCT taken, a cone beam computed tomography x-ray, which affords us that opportunity to see it in different dimension. So I wanted to share that with you. Let's see here. So this is it. So you can actually see, and it's a little bit hard sometimes to visualize, but you can take sections of it to see. So for example, this is 1 dimension and a 2nd dimension. This is in an x-ray form, like you were looking straight down on the teeth, but not looking at the very edge of them, the very top of them, but looking at about the 2/3 of the way down in there. So you can see the little holes in the teeth, which are actually where the nerve of the tooth is, in the dead kind of center of that tooth, of the tooth. But you can see here on these lower front teeth, this indentation right there. So you see the bright white here, which is the outer plate of the jawbone. And then you can see this indentation right there. So there's actually a lack of bone right there. And so when you take these images, you can actually kind of overlay them. And it seems a little odd, but I think Halloween is one of the better times to even be thinking about it. But it's almost like you could see the jawbone, like the skull part of it, the jawbone here, the skeleton. So not the tissue, not the muscle or the skin or anything. You can actually see that bone. And so here are the roots created there. And right here is that hole. So in this instance, if I go back to this x-ray, a 2-dimensional x-ray, so we can see the height and the width, and you can see that dark shadow right there. You can see that something's going on, but you can't quite see how far it goes. But when we have that 3rd dimension, we can see that it actually is an infection that comes out the front of the bone, not the tissue, but the bone right there. So really cool. I thought I'd share it with you. It may not be interesting to you, but I think it's pretty neat. And I love sharing things like that with my patients. If you have any questions, write them down in the comment section because I'd love to hear them. Hope you have a great weekend.